first, within the department, we had 100 of our staff get together and talk about disparities, about equity, and particularly about the differences in racial populations. Because if you look at the disparities, be they income, education, LGBT, geography, if you look at all of those disparities that occur in those categories, people of color and American Indians are always at the bottom in each of those categories. And talking about race is a difficult thing for us to talk about. So we decided that we really needed to be front and center about dealing with racial issues and the discrimination that occurs with populations of color and American Indians in all aspects of our society, what we're calling the institutional racism that exists in our society. So we are recommending in this report that to advance health equity, we really need to take that health in all policies approach. We need to start thinking about doing health impact assessments on some of the big issues, the policies that are moving forward. What's the health impact of a minimum wage bill? What's the health impact of any policy related to school advancement? What are the health impacts of housing decisions that are made? What are the health impacts of the transportation policies that are made? So we really need to start looking at that. And this is where you can take a leadership role as policymakers in our state to really raise those questions. What are the health impacts? We also have to continue to invest in efforts that are currently working. As I said, this is not the first effort. We have been working on health equity, and a lot of the things are still working. Certainly, work that we've been doing with tobacco, for example. Tobacco disproportionately affects people of color and American Indians, and the minority populations have been targeted by the tobacco industry. We need to continue to work on those kinds of issues. Also, we need to continue to work on breastfeeding. We need to work with all of the community agencies that you're going to be hearing about today, with all of the work that the good work that they're doing to continue those efforts. We, as a state health department, need to start taking a leadership role in advancing this. We need to make sure that we develop our partnerships and strengthen relationships with local public health to make sure that they take on advancing health equity as a central challenge. Certainly with all the grantees that we make in all of our programs that we have at the health department, we need to really make advancing health equity a central component of that.